All right, everybody, welcome to our 7th and final episode of Body Systems Summit. This, I hope, has been a really interesting and informative experience for you guys. I hope that you've learned a lot about not just the human body, but your own body, and used what you've learned to help start making some connections with yourself and your own health and wellness. So this will tie it up for us. This is the endocrine and reproductive systems. So I'm going to split them into two parts because even though they're related, they are separate, and I don't want things to get confusing. So we'll start with the endocrine system. We'll go through all of that, and then we'll go through the reproductive system. So again, we'll start with endocrine. So the endocrine system is a network of glands and organs. They are located all throughout the body, and their job is to regulate and control a lot of the body's functions. So these organs use chemical messengers called hormones. You've heard this term come up before. We all know what hormones are at this point. So now you're going to kind of learn about what organs secrete what hormones and what those hormones do. So each gland produces at least one hormone, so some of them produce more than one, but each hormone targets a specific function. Okay, so this is why we have so many different hormones, because there are a lot of different functions that they need to perform. So it's easier this way. So the endocrine and the reproductive system work very closely together. So this is why I grouped them in this presentation, because again, I want you to see how they work together. So the first thing they do is to regulate the production of sex hormones. So this would be like estrogen, testosterone, progesterone, and so on. The endocrine system stimulates reproductive organs to produce their hormones. So again, the hormones are these chemical signals, right? Chemical messengers. So they send signals to whatever parts of the body they're impacting. Some organs are actually both endocrine and reproductive. So some of them have dual functions. And then other organs are endocrine and exocrine. So exocrine means that the gland or the organ releases hormones into the bloodstream. So an example of this is the pancreas. And I'll delve into this a little bit more to explain how that works. But endocrine cells are also found in the GI tract, the placenta, the adipose tissue, which is our fat tissue, kidneys, skin, and liver. So the basic endocrine functions are to secrete hormones into the bloodstream. They work with metabolism, growth and development, as well as sexual function and reproduction. There's some function in blood pressure regulation, the sleep-wake cycle, which is a really big one, and regulation of appetite. So if you look at this graphic here, you can see some of the different organs and their respective hormones that they secrete. So for example, the pancreas, this is responsible for secreting insulin, and then glucagon, which is basically the opposite of insulin. So insulin helps to lower blood sugar, where glucagon helps bring it up if it's low. The adrenal gland releases cortisol, which is that fight or flight hormone. It also releases corticosteroid hormones like corticosterone, and also aldosterone, which has to do with fluid regulation. The thyroid, of course, releases thyroid hormones and calcitonin. The pineal gland releases melatonin. So this is our sleep hormone. This is what regulates our sleep and wake cycle. Okay, so, and then down here we have our sex organs, like the ovary, which produces estrogens and progestins, and in males, the testes, which will produce testosterone. So those are just some examples. So this is kind of a similar depiction, but in chart form. Again, the adrenal glands will release adrenaline and cortisol. So some of our stress hormones, adrenaline is what also kicks in during the fight or flight response, which is what makes your heart race, makes your blood pressure increase. It actually also increases the metabolism so that you have the energy to flee from whatever the threat is. It also produces the hormone DHEA, which is activated during puberty, which is what causes body hair to grow and body odor to be produced. This eventually becomes testosterone in the adult. Okay, pituitary gland has a bunch of different ones. One of which is the follicle stimulating hormone. So this controls egg and sperm production. And then you have luteinizing hormone, which controls estrogen and testosterone production, as well as ovulation. And then we have some that have to do with childbirth and lactation, like oxytocin and prolactin. So oxytocin is what's activated during childbirth. Some people may have been given what's called Pitocin, which is basically just a synthetic version of oxytocin, which helps induce contractions. And then we have ACTH, which controls the adrenal gland. So a lot of these, it's like a chain reaction. So a lot of these, one hormone is released to signal another hormone to be released. Okay, so there's a lot of checks and balances, and there's a lot of upstream and downstream signaling here. And then again, as I mentioned, the melatonin is the sleep cycle control. The thyroid hormones help to regulate metabolism and energy. They also have to do with heart rate and digestion, muscle and brain development, and bone health. The parathyroid hormone helps to regulate our phosphorus and calcium levels in our blood and our bones. So it works with the kidneys. You may remember how the kidneys have to convert that vitamin D to calcitriol that the bones can use. So parathyroid hormone helps with that process. The hypothalamus releases dopamine. Okay, so dopamine is like our pleasure center. Dopamine is what drives our motivation. It's our reward system. Okay, so dopamine is the thing that most of us are kind of eternally chasing, right? To always find that thing that makes us feel good. So that's your hypothalamus at work. Somatostatin is a hormone that tells other hormones to stop. So as I was saying in the previous slide, you know, a lot of this is a chain reaction, and something has to keep them in check. So that's somatostatin. It kind of puts the brakes on everything. You have some thymus hormones, which has to do mostly with the immune system. So it tells the immune system to make T cells. Estrogen and progesterone by the ovaries. So this is responsible for female sex characteristics. When women start going through puberty, or when girls start going through puberty, this is when these hormones start kicking in. They also regulate the menstrual cycle. And progesterone regulates our serotonin, which is our happy hormone. So dopamine is like the pleasure hormone, and serotonin is the happy hormone. Progesterone also prepares the uterus for pregnancy. And then testosterone helps the sperm cells to mature and the male sex characteristics to develop. So these are just some anatomical pictures of what they look like. So here are the pineal gland, the pituitary gland, and the hypothalamus. So these are all located inside the brain. They're all kind of embedded in the brain tissue there. Over here you have the pancreas. This is a kind of cross section of the pancreas. So again, remember that the pancreas stretches all the way across the abdomen. So it kind of goes from I think the larger part of it is on the right, and the tail goes over on the left. So here you can see that it has both endocrine and exocrine functions. So endocrine secretions would be the insulin and the glucagon. So again, this is for blood sugar regulation. And then its exocrine secretions would be the digestive enzymes. All right. So if you remember all the way back to episode 1, when we were talking about, or actually I guess this was also episode 2, because pancreas is one of those accessory organs of the digestive system. It releases enzymes to help us break down primarily fats and sugars. And then it also releases some bicarbonate to help with buffering the pH of the GI tract. And then this is the thyroid gland, which kind of sits on top of the trachea, or like in front of the trachea. So the trachea is right behind here, and the thyroid kind of lays over it. Okay, so I want to talk about the HPA axis. All right, it's very long. This is why it's abbreviated, but this is the hypothalamus, pituitary, and adrenal gland. So these 3 organs together form what's called the HPA axis. this is a really important little system to understand, and you're going to see why in a second. So this is connected to both the endocrine and the nervous systems, and it plays a strong role in the body's hormonal balance and stress response. So basically how this works is, sorry, I'm going to sneeze. Excuse me. Okay, so the HPA axis is activated by any type of stressful event. It could be, you know, an acute situation, or in the cases of chronic stress, this is constantly activated, but we'll get to that. So you have a stressful event activating it. The hypothalamus activates the sympathetic nervous system. Okay, so things start ramping up. Again, the heart rate goes up, the blood pressure goes up, the adrenaline and these hormones, cortisol, start increasing. Then the pituitary gland releases what's called adrenocorticotropic hormone, and this stimulates the adrenal gland to release that cortisol. And here we have the fight or flight response. So the HPA axis is responsible for that fight or flight. Okay, and then we have this like regulatory system. It's called a negative feedback loop. So basically, once the stressor, whatever the event is over, this loop tells cortisol, like, okay, we're good, the threat is gone, we can relax now. But this, of course, is assuming that the HPA axis is functioning correctly. And the problem is that when we're under prolonged stress, this loop is suppressed. So in other words, the cortisol will continue to be produced when it's really only meant to be a short and quick release. Okay. And the problem with this is that over time, if cortisol is constantly being produced, this contributes to a variety of health issues, but diabetes is one, memory loss, hypertension, nerve damage, and then dyslipidemia, which is basically an imbalance of the blood lipids. So it may be that some are high, some are too low, just that they're not in a normal range that they should be in. It's also implicated in depression and anxiety disorder, which makes sense if you think about it, right? Because anxiety is part of this response. Anxiety is part of the fight or flight response. You get kind of that butterflies in your stomach. That's your adrenaline, and that's your cortisol. So people who are under constant stress, or, you know, arguably even in a state of trauma, have a lot of anxiety. So anxiety is a physiological response. It's not just like, you know, a thought or a feeling. It is a physical reaction. So that's really important to recognize. And this is exactly why we feel it physically when we have anxiety. Okay, so again, hormones are the body's chemical messengers. They are made from what are called prohormones, which are kind of like precursors. All right. They allow organisms to interact with their environment and respond flexibly to that environment. So imagine if we were so rigid that we had no ability to respond to something, right? So if something happens that is out of the ordinary or out of your comfort zone, or, you know, anything, if we had no physical or emotional or mental ability to respond to that, we would just like fall apart and die, kind of. I mean, this is an evolutionary process, right? We have to adapt. We have to be able to respond appropriately to things. So hormones will interact with one another to maintain homeostasis. So that's the ultimate goal. As you can kind of see throughout the systems that we've discussed, the goal of essentially every system is homeostasis. So this is the greater goal of the human body, is this homeostatic balance. And that relies on this in part by this proper interaction of hormones with one another. The proper hormone function depends on a couple of things. Number one, the sensitivity to the hormone signal. So the cell has to be able to receive that signal. And then number two, the hormone has to be able to be metabolized. So we have to be able to use it. We have to be able to detoxify its byproducts, and we have to be able to excrete it when we're done with it. And then also the ability of the hormones to interact with each other and their transportation, their conversion, their distribution. Where are they going? Are they going to the right place? Are they being converted into the right thing? You know, so it's obviously very complex. It's not just, do you have enough of this hormone, but is it being used? Is it getting to where it needs to go? So some symptoms of hormone imbalance are listed here. So this includes things like mood swings, if you're still menstruating, if your periods are very heavy or very irregular or very painful. These are definite signs of hormone imbalance. PMS, by the way, not a normal function. PMS is a dysfunction. So if you have menstrual, like really periods are not meant to be painful and like debilitating. So there's a lot of discussion on this in the functional world about PMS and PMDD, which is an actual disorder related to very severe PMS symptoms over a long period of time. That these are signs of hormonal dysfunction. Anxiety, as we sort of talked about already, constant fatigue. Okay, so we're not just talking about being tired when it's normal to be tired at night, but just throughout the day, or times when you shouldn't be tired. Disturbances in your sleep, right? So definitely means our sleep-wake cycle is off. Maybe our melatonin production is not appropriate. Low libido, acne. Okay, so a lot of times, like I know for me, I know when my cycle is coming because I start getting acne on my chin because that hormonal shift occurs. Weight gain or weight loss for other reason, that you can't really explain for other reasons, like you haven't changed your diet, you haven't changed your activity level. That often can be explained by hormones. Uterine fibroids are a sign of imbalance. Brain fog, which is sort of this non-specific feeling of like my brain doesn't work right, or I feel foggy, that's hence the name, or like you feel sort of fuzzy maybe, or like just things aren't clear. Hot flashes, which, as we know, happens during menopause, which of course is an imbalance of hormones as well. And then just sort of that general IBS type presentation. Okay, so this is a little overly complicated explanation of how hormones are made, but I just kind of want to show you guys this main thing, which is that cholesterol is that prohormone. So cholesterol is the foundation for not all of our hormones, but most of them. So this kind of jumps back to last week when I was talking about the cardiovascular system and kind of the dangers of overly suppressing the liver's cholesterol production. So if you look at this graphic, you can see how many things are made from it. You have progesterone, you have cortisol, you have testosterone, you have estradiol, which is the form of estrogen that our bodies need. Okay, we have aldosterone, we have all these other kind of things in between. So multiple hormones depend on adequate production of cholesterol. So suppose you've been on a statin for a long time and you've started developing some of those symptoms I listed previously. Part of it could be that you aren't making enough cholesterol to produce some of these other hormones. This is just a little cute little drawing of how the cells produce hormones. Okay, so this is just showing you, this is kind of, no matter what the gland or the organ is, this is basically how it works. So this is this is whatever your gland is. This is the cell that produces the hormones. And so you can see the cell, to me, they look like little cookies. Maybe I'm just hungry, but they're releasing their little hormones into the bloodstream, transported throughout the body to wherever they need to go. So the cool thing about hormones is that they will only bind to the specific cells, the specific target cells. So the little target cells in whatever organ or whatever this hormone is meant for, they have these little binding sites. So that's what these little guys are. So the cell like kind of reaches out and it's like they dock. It's like a ship docking to a dock. So they will only bind to those specific sites. So if this receptor, so you see here, they're not binding because they're like, nope, wrong shape. So they're the exact shape of that hormone. It's actually very cool to me. So they know where they're supposed to go, and they know that if the binding site doesn't look right, they're like, nope, this isn't the place for us to go. So they keep on keeping on. And then once it binds to its appropriate receptor, this is where the response occurs. So then the chemical message is sent again, to either produce a hormone, make an enzyme, tell the cell something to do or not to do. So again, it just depends on what that hormone is intended to do, but it can't do anything until it's bound to that receptor. All right, so I want to show you some more of the interaction of hormones. So calcitriol, which again is that active form of vitamin D in the body, that is needed to make thyroid hormone. And thyroid hormone is needed to make estrogen. And estrogen is needed to make progesterone and vice versa. So estrogen and progesterone have kind of this feedback, this two-way feedback thing. You also need adrenaline to make thyroid hormone. You need adrenaline to make cortisol. You need cortisol to make thyroid hormone. You need cortisol to make insulin. You need insulin to make testosterone. So I mean, or rather, I should say, not necessarily that you need them to make it, but you need them to create a signal for them to function. So it's not necessarily that this makes this in all cases, but they're in some way communicating with each other or sending a signal to activate or not activate or whatever. Or I need more of this thing, or I need less of this thing. Like it's all part of this very complex signaling system. This is a kind of a picture of the hypothalamus pituitary thyroid axis. So there's lots of axes. I chose to focus on the HPA because we know a lot more about it in terms of its effect on physical health and how it is related to trauma and anxiety and that sort of thing. But you also have an HPT axis, which involves the thyroid. Okay, so you can kind of see again how the hypothalamus is sending signal. These are veins actually, but sending different hormones. So this is your thyrotropin releasing hormone. So this is needed to make thyroid stimulating hormone. And then this travels to the thyroid through the bloodstream. And then the thyroid converts those into T4 and T3. All right, so again, it's like a whole pathway, it's a whole system. So one relies on the other. So if the hypothalamus is not producing what it needs to be producing, and the pituitary is not producing what it needs to be producing, then the thyroid cannot do its job either. So it's all, again, you could literally trace it all back. Okay, so let's talk about digestive hormones. There's a whole bunch of these guys. So just as a reminder, we have various organs contributing to digestion, not just the actual organs of the digestive system, but again, the pancreas and these other secretory endocrine glands. I'm not going to cover all of these, but just a couple for you to be aware of. Number one is ghrelin. So ghrelin is our hunger signal. So that tells you, hey, I'm hungry, it's time to eat. And then you have secretin, which regulates the pH of the GI tract. So this tells you how much stomach acid you need to release. And it supports the enzyme function of the digestive tract in general. You have something called gastric inhibitory polypeptide, which stimulates insulin. So when the blood sugar is high, this guy kicks in and tells your pancreas, hey, we need some insulin over here. And the pancreas does its thing. Peptide YY, which decreases the appetite. So it tells you, all right, I'm good. The pancreatic polypeptide sends some hunger and satiety signals. So it tells your brain that I'm hungry or I'm full. It also inhibits bile production. So it tells the gallbladder, like, slow down, we don't need any more bile now. And then the somatostatin stops gastric acid secretion. So after you're done eating a meal and the stomach has released enough acid to break down the food that you've eaten, somatostatin kicks in and tells it to knock it off. It also regulates nutrient absorption, and it can slow the motility of the intestine as well. So it slows down the movement. Okay, so let's talk about some dysfunctions of the endocrine system. Diabetes type 1 and 2. We've talked about these a bit already when we discussed the pancreas, but as a reminder, the type 1 is an autoimmune disease, and the type 2 is an acquired disease, lifestyle disease. Thyroid disease. So hypothyroid is where the thyroid is low, doesn't make enough hormone. This also can be autoimmune in nature, and this is called Hashimoto's disease. So the thyroid attacks itself. And then hyperthyroidism, which is also called Graves' disease, this is where there's too much thyroid hormone. We have PCOS, which is becoming increasingly more common in young women. Infertility, obesity, adrenal insufficiency. So we have Cushing's disease, which is excess cortisol, Addison's, which is not enough. Adrenal fatigue, though, is what precedes these. And the problem with adrenal fatigue, it is not clinically recognized. So if you were to have your adrenal function tested, it might test normal, even though you don't feel normal, and you know that something isn't right. No doctor will tell you that you have adrenal fatigue unless you go to like a functional medicine doctor or like a naturopath or somebody who follows a little tighter parameter. So unfortunately, a lot of people don't get diagnosed with any of these until there's a clinical presentation, which of course we would not like to wait if we can help that. Some of the causes of that are genetic mutations, autoimmune disease, damage or injury to any of the endocrine organs or tissues. Tumors can cause this. So if you get a tumor on your thyroid or a tumor on your adrenal gland, excessive prolonged stress, we sort of discussed this already. So the adrenal glands become damaged due to that constant production of cortisol. They get exhausted. They literally are fatigued. So it probably goes without saying that if you're under a significant amount of stress over a long period of time, you probably have adrenal fatigue. So we just go ahead and assume you have it based on your symptoms and the level of stress that you present with, and then we treat it that way. So fortunately, we can recognize it based on symptoms, and we don't need a lab test to confirm it. And then nutrient deficiency is a big one. Vitamin D. Vitamin D is, we have to kind of rewind again. Remember how I showed you how cholesterol was so important for producing all these hormones? Well, you need vitamin D to make cholesterol, and you need vitamin D to make literally any hormone in your body. So if you don't have enough vitamin D, it goes without saying you're probably not producing enough hormones. You also need iodine, especially for your thyroid hormones. So iodine deficiency can also contribute to this. And then heavy exposure to pesticides can also damage some of these systems here. And I think in the reproductive section, I talk a little bit about some of that, I believe. So some of the symptoms of these dysfunctions, slow digestion is a big one. A lot of people with hypothyroid have constipation. There's also something called gastroparesis, which is where the stomach motility is slow. So you see this a lot in people with uncontrolled diabetes. What happens is that when the blood sugars are constantly elevated, the vagus nerve is impacted, and so the vagus nerve signal telling the digestive system to contract those muscles, that signal is impaired, and so that peristalsis is slowed down. General insulin resistance is a symptom of endocrine dysfunction. Constant fatigue, or just kind of like feeling weak. Again, when you have no other real explanation. Insomnia, can't lose weight no matter what you do. I hear that all the time. I've done everything. Anxiety is a symptom for sure, as we sort of talked about with the HPA access. Early puberty. So boys and girls going through early puberty, that could mean something is amiss. Migraines are a big one. This is a big area being studied currently to try to figure out the exact cause of migraines, because we still don't really know. And then any kind of disruption in the menstrual cycle. Okay, so we've already touched on a couple of these, but again, vitamin D, critically important. This is why I am so hardcore about vitamin D and asking people, what is your vitamin D level? Do you know what it is? Because you need it to convert to that calcitriol to make thyroid hormone and many, 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 many others. All right, so you really need to know your vitamin D status. I cannot emphasize this enough. Despite what your doctor might say, they might try to argue with you, but you need to insist that you get a vitamin D. Cholesterol, as I mentioned, is the basis for many hormones. Omega-3s, so these are those good healthy fats. They help to control cortisol production, cortisone and cortisol. So that's one way that you can help yourself. If you are under a lot of stress, you can eat more of these healthy fats. You need iodine, iron, and selenium to make thyroid hormone. You need vitamin A and zinc to support those receptors. So remember, your receptors need that specific little binding site for the hormones. And if they're mal-shaped or malformed, then they're not going to bind. So you need zinc and A for that. Protein is important because you need some of those amino acids to make different hormones, especially those brain hormones. So like serotonin and melatonin and dopamine, you need amino acids for that. CoQ10 is an antioxidant. This helps support fertility hormones. And then various B vitamins are needed to make estrogen and progesterone, and they also help to eliminate any extra hormones. So you only need a certain amount, and we don't want extra levels circulating around. Okay, so some ways that you can support the endocrine system. Number one is to limit the use of plastic, which I understand it is everywhere. It's pervasive in our environment, in our food supply, but really do what you can to limit your plastic use. Many substances in plastics are hormone disruptors, such as BPA in the plastic bottles. These are known to increase estrogen levels and increase the risk of hormonal cancers. And there's a lot of evidence that the increase in breast cancers over the past few years has to do with this. Now, I wrote this presentation last year before they really started getting hard into the microplastics conversation. Like, that's a pretty new discussion, but believe that those microplastics are part of this too. They also contain these multiple hormone disruptors. And we know that they're in the water supply. We know that they're in the food supply. So you can only do so much in that case. So the best thing you can do is to try to avoid plastic containers. Even going so far as, like, if you buy something in plastic, when you get home, put it into something else. Put it in a mason jar. Put it in, some other type of glass container or silicone container or metal or whatever. So try not to even store things in plastic if you can help it. Another thing you can do is get your sleep cycle regulated. I'm a big fan of L-theanine. This is basically the precursor to melatonin. So when your body is making melatonin, this is the last substance it's converted to. So this actually makes your brain produce more melatonin. Whereas just taking melatonin, it's gonna do it for a couple of hours and then you're not producing anymore. So a lot of people report that they'll fall asleep, but then they wake up in the middle of the night and they can't go to sleep again because that melatonin's been burned up. So take L-theanine, it will keep you sleeping through the night. And then magnesium is a wonderful one as well. This is a mineral that the body needs anyway. There aren't too many people who wouldn't benefit from taking magnesium, and it won't hurt you to take it even if you aren't, quote, deficient. Stress and anxiety management is big. You can do yoga and meditation or whatever your spiritual practice or any type of mind-body practice that you can do. Adaptogens, which are herbs that can help the body adapt to stress better. So this actually helps to help the adrenal glands not produce so much cortisol, for example, and so much adrenaline. So it kind of like calms down that physiological reaction. So examples of this would be things like ashwagandha, some of the mushrooms like chaga and reishi mushroom, some of the ginsengs. There's various ones for various things. I can recommend if you want something specific, but those would be good to look into. And then eat foods that support hormones. We talked about all these nutrients that your body needs to make hormones properly. Eat those cruciferous vegetables so we can eliminate excess hormones. Avocados, fatty fish. Remember, you need those omega-3s. Organic soy, and I emphasize organic because non-organic soy is very heavily sprayed with pesticides. So I wouldn't touch it if it's not organic. Seeds are excellent. So like flax seeds, pumpkin seeds, these are good sources of what are called phytoestrogens, which I think I'm going to talk about in the reproductive section, but phytoestrogens help to regulate the amount of estrogen the body uses. So they can, if you need more, they'll upregulate the receptor. If you need less, they'll downregulate the receptor. So they're really cool. They can sort of communicate that. Also things like beans and whole grains and sweet potatoes. And then on the flip side, we want to limit alcohol, limit the processed and fried foods, added sugars, and artificial sweeteners. So by this point, you guys should probably see there's kind of some patterns here and some common threads in terms of our diet. Trying not to drink much, trying not to eat a lot of fast food, fried food, sugar, and eating more of these good whole foods from the earth. Oh, well, look, here you go. There's an adaptogen slide. So again, they directly impact the HPA axis and they help to maintain that homeostasis. So because sometimes we can't eliminate the stressor. It's just sometimes it's not possible. Like we can't just like throw our kids out the window. I'm sure we would all sometimes like to, but we can't. That's frowned upon. So we have to figure out how to cope with it in a healthy way. That's not drinking or eating or whatever. The cool thing about adaptogens is they won't have an impact on other body systems in any negative way. So like there's not going to be side effects. So again, you can see a list here of the different ones, the different organs they support, and what their benefits are. So this can help you choose one if you're interested in trying them. This can help you pick the right one for you. Okay, let's take a breather. I'm going to take a sip of water, and then we'll jump into part 2. Yeah, Connie, I love holy basil. That's actually one of my favorites. I do enjoy a holy basil tea. It's actually also called Tulsi. Sometimes you'll see it that way. All right. Deep breath. All right, part 2. Here we go. All right, so reproductive system is the collection of the organs that allow for sexual reproduction. They're different in men and women, of course. These are largely regulated by and interactive with the endocrine system. So again, you're going to kind of see how this all ties up. But the basic reproduction process is to, first of all, release the egg from the ovary, and then you get a fertilization by the cell. And then there's a transport of that ovum up to the uterus. And then it implants there, right? It's like, oh, this looks good. Let's set up shop here. Then we form the placenta. And as the embryo adds cells to it, it becomes a fetus. And then within the placenta is where the fetus is maintained and fed and developed. And then eventually we have childbirth and then the expulsion of that placenta. And then breastfeeding and childcare. And then that's all she wrote for the next 18 years, give or take. Okay, so remember I said we have multiple axes. So we also have a hypothalamic pituitary gonad axis, the HPG axis. So this is one way that the endocrine and reproductive systems interact with each other. The reproductive organs are reliant on hormones produced by the hypothalamus and pituitary glands. So if you have HPA axis dysfunction, this will also translate to HPG dysfunction. All right, so again, really just seeing how all these things are connected here. But that luteinizing hormones and follicle stimulating hormones are needed to be produced up here in the pituitary to get to the respective gonad, which is the ovaries or the testes. And these are just some, I'm not going to spend too much time on these, but these are just anatomical depictions of, this is the uterus here. This is the inside of an ovary, in case you ever wondered what your ovaries look like on the inside. That's what they look like. And these are eggs in various stages of development here. Well, they're called follicles at first, but anyway, so that's kind of what they look like. And then this is the fallopian tube right here. Male reproductive system. I know there aren't any men here, but we'll just real quick. The penis is controlled by the autonomic nervous system. I think we all know that. So it basically does have a mind of its own, as they say. But the testes make testosterone, and the sperm is formed in this little area right here. The sperm travels through these tubes called the vas deferens. So when men get a vasectomy, the vas deferens is what is severed. So they cut this and then they tie off that. I think they tie the ends off, or now they might just cauterize them. I'm not sure. But yeah, so this is what a vasectomy acts upon right here. But normally the semen is formed and then it travels through here to the vesicles, and that's where it mixes with the sperm. And so in order for the seminal vesicles to form semen, they rely on the hormone androgen, which is produced by the testes. And then you have these ejaculatory ducts in the prostate, and then muscle contractions that help it get out of the body. So some of the reproductive hormones, just again to kind of touch back on where they're made. So the gonadotropin hormone is in the hypothalamus, luteinizing is in the pituitary, as is FSH. Estrogen is from the ovaries. Estrogen is a very sensitive hormone. It is highly subject to outside influence, i.e. our environment. So there is a whole category of chemicals called xenoestrogens. These are our environmental sources of estrogen that can impact our own estrogen level. So in other words, these can bind to our estrogen receptors and impact them. Examples of this are growth hormones that are given to animals that we eat. Those hormones are identical to ours. All right, so the body recognizes cow hormones, chicken hormones, pig hormones. They're identical. So those can influence our body. Plastics, as we talked about, phthalates from fragrances, and then fire retardants, which most of us aren't exposed to fire retardant on a regular basis, but sometimes clothes are coated with it, or like your couches actually. So I should retract my statement, because actually we are pretty exposed to it. They treat furniture with it so that you don't. They started doing this back in the day when everyone was smoking cigarettes in their house, so that your furniture didn't catch fire. Okay, so yeah, so furniture is treated with fire retardant. So anything with a fragrance to it, whether it's your laundry detergent or your perfume or your dryer sheets or fabric softener, if that has fragrance that is not specified to be from a natural source like essential oils, it is a phthalate, and it is a hormone disruptor. So that's what if you take away nothing from this, that would be my biggest piece of advice, is to go through what's in your house and look for things with fragrance and throw it away and buy unscented stuff. It's crazy. Connie says kids' pajamas have flame retardant. Good Lord. Okay, well, there you go. And then we kind of talked about these already. So this is just to sort of show you how hormones will fluctuate throughout the menstrual cycle. All right. So you can see that estrogen. So estrogen is the orange line and progesterone is the purple. And then so you can see how they kind of crisscross. So when you're ovulating, this is the middle of your cycle, both things are low. All right. So when your estrogen is lower, this means testosterone is higher. So this is why the sex drive tends to be stronger, which is another evolutionary advantage, because if you're ovulating and you're trying to get pregnant, then it makes sense for your sex drive to go up, right? Otherwise, you won't make much use of it. And it should also be noted that when estrogen drops, you also tend to get a drop in serotonin. And so your mood may not be so good. You might have a good sex drive, but you're grouchy. So that's going on in the middle. The peak of your estrogen production is just prior to that, during the follicular phase. All right, so we maybe have good energy here, maybe too much energy. We might be real motivated feeling before we have the crash. And then when we're in the luteal phase, this is where the progesterone is highest. Again, the estrogen is still a bit low here, so you still may experience some mood changes. So this is kind of where we possibly start having some PMS, is towards the end of this luteal phase. And this is where we get hungry and irritable, possibly bloated. Maybe we start craving all the things. Okay. So really this is like our prime right here, is that follicular phase. That's where most women tend to feel best. And then we feel worse right here. And then, right kind of at the beginning of this menstrual thing where you're tired and you're cramping. The fatigue, a lot of that is due to the blood loss. It's due to low iron levels. So a lot of women need to supplement iron during their periods, especially if it's heavy. Okay, so I want to talk about the dysfunctions of menstruation a little bit. Of course, it's a very natural and necessary process. Most women's cycles are between 28 and 30 days. Some are a little shorter. Average onset is about 12 to 14, although this is also getting earlier and earlier, and there's a lot of speculation about that environmental impact of the xenoestrogens on that. So sometimes this is dysfunctional. So early puberty, PMS, amenorrhea, which is where you don't get a period, or dysmenorrhea, where it's very painful or very heavy, sometimes to the point of where it's debilitating for people, or if your cycle is irregular. So like maybe 1 month it's 21 days and next month it's 29 days, like it's all over the place. So these are things that can disrupt the menstrual cycle. Stress, birth control, which birth control is used to intentionally disrupt the menstruation, right? So number one, so you don't get pregnant. Number two, to help regulate some of these symptoms, like to help make your periods less painful or less heavy or whatever. Extreme physical activity. So women who have very low body fat, so these very lean athletes, tend to develop amenorrhea. And if you're eating a very high carb diet, this could be problematic, typically because you don't have enough of the right amino acids to make the hormones that you need. So these are some causes of infertility in men. Low sperm count, and this can be caused by hormonal imbalances. Diabetes can also cause low sperm count. Diabetes can also cause erectile dysfunction and premature ejaculation. Exposure to xenoestrogens, those environmental estrogens, that's also over here on the female side. Smoking and high blood pressure, and then use of steroids, particularly like the type that men use to get big muscles, like that kind, because those are androgenic steroids, and so they will affect the testosterone. In women, PCOS can cause infertility, so can endometriosis, which is a chronic inflammation of the uterus, being overweight or obese, having thyroid disease, uterine fibroids, and also eating disorders, because again, they can affect the body fat and nutrient status as well. So PCOS, again, is becoming more and more prevalent among younger women, and like women in their 20s. It's the leading cause of female infertility. And this is basically where you get these little cysts or these little fluid sacs on the ovaries. And they contain all these immature eggs. And so what happens is that the mature eggs are failing to release. So there's nothing to fertilize. Typically, the onset is right after first menstruation. So again, a lot of women will develop this before they're even done with puberty, which is unfortunate. But you can see here irregular heavy periods. Sometimes they might grow facial hair, which is called hirsutism. It can affect their weight. They can get headaches, sometimes even things like fatty liver. PCOS is also associated with a higher risk of heart disease and diabetes. So we don't totally know what causes PCOS. This is still being investigated and studied, but we do see high levels of male hormones. We see insulin resistance. There's probably some genetic components to it. Metabolic syndrome is very strongly linked to PCOS, which is a collection of problems that you see in obese women or obese people, and then inflammation. So if you do have PCOS, one thing you want to do is eat plenty of healthy fats so that you can support your cholesterol production so that you can produce your hormones. Eat those phytoestrogens. So these are the things that bind to our estrogen receptors and help them regulate. You can easily get these in your diet and use them to your advantage. And you don't have to have PCOS to do this. You can eat them anyway, and you should eat them. They're also great nutrient sources. But some big ones are those seeds we talked about. Leafy green vegetables are a great source. Organic soy foods. There's also something called seed cycling, which can sometimes be helpful, which is where you eat different types of seeds at different points in your cycle. So like, I'm just being arbitrary because I don't know for sure. I'm not well trained in this. But for example, during your luteinizing phase, maybe you eat flax seeds. And then during your follicular phase, you eat sunflower seeds or whatever. I don't know exactly. But it is interesting. And it is used by some practitioners to help regulate that. You can limit your intake of sugars, gluten, and dairy products so that, number one, get the inflammation down, help get the insulin resistance down. And then also intaking adequate amounts of B complex vitamins and vitamin D. So you might need a vitamin D supplement. Again, if you have PCOS, or really, I don't know. I think everyone should know their vitamin D, like period. But if you have any kind of hormone issues, you need to know your vitamin D and then supplement so that you can, that's a very simple way to remediate some of this. You may also want to supplement EPA and DHA. I especially recommend this with my vegan patients because vegans do not get any good sources of these fatty acids in their diet. Unless they're eating a whole bunch of algae every day, which I'm assuming they're not. So if you're eating a vegan or plant-based diet, you should be supplementing these things. And then high intensity interval training or HIIT. These can improve the fat to muscle ratio. It won't spike cortisol. So keeping that cortisol down is always good. So you don't want to do very intense exercise like marathons and like CrossFit, because not only are they very hard on the body, but they can exacerbate PCOS. So you want to do more of this HIIT style, which HIIT style, if you're not familiar, is basically where you do like short intervals of different things, right? So you might do like a minute of a cardio exercise, and then you do a minute of a weight or something like that. There's a lot of different formats, but you're constantly doing something different. And it really helps burn fat. And if you're burning fat, that also will help improve PCOS. Okay, let me get out of this so I can see the chat, and I'll address any questions that you guys have, or if you want to chime in verbally, that's fine too. I can't make the screen. Oh, I have to stop sharing the PowerPoint. Okay, here we go. All right, let me check out the chat, see what you guys got in there. What do you recommend to test drugs and statins disturbing your hormones? I'm not aware of any real specific test. I mean, I think it goes without saying that if you're on a statin chronically, I mean, your doctor will be checking your cholesterol levels. So if your cholesterol levels go below what's considered the normal reference range, then there's probably a solid chance that they're disrupting your hormone production. You know, I have seen people, so right now they recommend that your cholesterol be under 200, but I see people with cholesterol levels of like 80 and 90, and your doctor will tell you that that's fine. I disagree with that. And, you know, seeing HDLs of like 20, which is your good cholesterol, you want that number to be higher, but unfortunately statins will suppress those. So to me, if your total cholesterol is under 100, or I would say even under 140, That's too low. So yeah, there's not a specific test that I'm aware of without you actually testing the hormones individually. So it's more of a clinical assumption I would make. Yeah.
Well,
Problems. Yeah, erectile dysfunction is also an early sign of heart disease. Yes, absolutely, Connie, because erectile dysfunction is due to a lack of blood flow to that area. So it can be a sign of high blood pressure. It can be a sign of, sort of general inability of blood to get where it needs to go. A great natural remedy for erectile dysfunction, by the way, is beets. So if anyone's husband has issues with this, one really good way to do this is to get more beets in his diet. So he can drink beet juice, you can roast them, he can eat pickled beets, but beets help produce nitric oxide, and nitric oxide is needed for that blood flow. And it will help in general if they have any kind of heart disease, but beets can be very helpful for that. So little tidbit for you. Connie says she has a good nut bar recipe if anybody wants it to get those good healthy fats and minerals. All right, any other questions, guys?
I think that was good, Jane.
All right, very good. Well, thank you all for spending this last 7 weeks with me, and I hope you learned a lot and you aren't too overwhelmed by the information, but rather feel empowered and ready to, take some control. If you want more help working with this, you guys know I do functional nutrition. I am very holistically oriented and trained. So, you can always reach out to me for consultation if that's something you would like to explore further. But I hope everybody has a great night. Thank you again for joining us, and have a good night.